guest lecture launching a human milk bank, insights and challenges and triumphs. I would like to call upon Dr. Sushma Malik ma'am onto the stage.
So morning we heard the great speakers talking about a great debate on providing the pooled human milk. The speakers said that we have the capacity to serve the whole country with the pooled human milk. But what are the challenges? How can we provide this whole country with the pooled human milk through the breast milk banking? We are now going to listen to great visionary who has been working in this field of human milk banking for so many decades. Dr. Sushma Malik ma'am. It's my great honor to introduce Dr. Sushma Malik ma'am, who is a board director, International Lactation Consultant Association, President, Breastfeeding Promotion Network of India. She has been working in this field of human milk banking for so many years. I request the topic, the guest lecture today is what are the human milk banking, the insights, challenges and triumphs. Let's listen to Dr. Sushma Malik's ma'am's experiences. Thank you for accepting our invitation, ma'am.
My pleasure. At the outset, I'm very thankful to LAMBCON2024 to give me a chance to speak here on launching a human milk bank, which rightfully, I know a lot in the audience would call it as CLMC, but since I was given this as a label and as a title, so I've continued on that. Let me tell you all about the insights, the challenges, and the triumphs of setting up a human milk bank. I have no conflict of interest, and I follow in my practice the IMS Act and the International WHO Code of Marketing. So let's look at what are the insights and what do we know about human milk banking. What is the WHO policy of feeding low birth weights and preterms? We all know that human milk contains numerous protective components, and I don't have to really enumerate them. And they are really required for the growth and development, especially for the preterms and the very low birth weights, or those who are sick. We all know this, and WHO and UNICEF has endorsed this, that we should use the pasteurized human milk from a human milk bank to feed these babies as the first alternative when the mother is unable to provide her own milk. So why is there a need of human milk banks in India? We all know that the challenges that are faced by preterms and low birth weight, we have a high prevalence and we know we have a poor outcome of these vulnerable infants. In addition, it is required for mothers who are facing lactation issues, factors like illness, insufficient milk supply, or even when maternal death has occurred. We also know that whatever are the existing infant nutrition solutions, there are lots of limitations. Formula feed as compared to, of course, breast milk for the... And of course, we need to address the health disparities just because we are in low resource settings. We know that this percentage is really high. In India, we have the highest number of the preterms, births in the world, and breastfeeding rates are really very suboptimal. Human milk is obviously the answer, and it's immunologically and a nutritionally packed thing which is to be given to these babies. Their low birth weights are facing immediate survival issues, and long-term neurodevelopmental outcomes depend on the human milk feeding. So providing breast milk to them, especially those who are VLBWs, the preterms and the sick newborns, will really reduce the neonatal mortality and morbidity, especially due to sepsis, NEC, and BPD as a morbidity in long term. To bridge this gap, an effort is being made by India and the government to open up maximum number of human milk banks. What is really a bank? I really don't have to tell you all, but just for completion of the slides. It recruits breast milk donors, collects, pasteurizes, and stores the donor human milk. It tests for the bacterial and other contamination, and then it is distributed to the recipient infants. The donors are typically healthy mothers, postpartum mothers, or mothers of the preterm babies. And pasteurization is essential to eliminate any infection, including HIV or SARS-CoV-2 contamination. And what does the scientific evidence really tell us? And scientific evidence tells us about the immunological benefits. It reduces the complications for the preterms and low birth weights, just like I've told you all before. And systemic reviews have shown that when pasteurized donor human milk, it was associated with 46% reduction in the incidence of NEC as compared to infant formula. PDHM is also associated with a 19% reduction in the odds of developing sepsis. So there are enough scientific studies to show that it is very much advantageous. And it's not just with our experience that we are answering, but among the preterms who received the mother's own milk, and when they were supplemented along with it, with PDHM, there was a 22% lower incidence of BPD. And they also required 3 days less of ventilator support as compared to those who were supplemented with formula feeds. So launching or setting up of a human milk bank is, everybody is knowing the 4 key components to set up a human milk bank, which I'm not going to enumerate every step, but B is the base where you have the person who is the champion or the leader who will head it. You need to do the staff recruitment, the location, the space, and the equipment. A stands for the awareness and the advocacy, the donor recruitment methods, the breastfeeding promotion, and the promotion of the policy as well as ensuring that research occurs. N is for the network for the donor pool, regulatory bodies, financial stability, and the information sharing. And K is for the key protocols which are at local and national levels. Do the assessment by using the HACCP method. 1 minute. And internal auditing is a very much a part of it. The operational steps to launching, which I've just said, include the feasibility study, securing funds, infrastructure step up, and recruiting and educating donors and staffing and training at the same time. We do know that we need to strengthen. So this was for the, I'm not going to repeat what I'm just showing you all, that this was regarding the setting up of a human milk bank and the 4 key components, and just use the word, just use the acronym BANK, where B is for the base, and 1 minute. B is for the base, the identify the champion, staff recruitment, equipment, advocacy. A is for advocacy, where breastfeeding promotion, donor recruitment, donor support, and make sure that you're following the key protocols using the good standards of practice and internal auditing. The operational steps were just told, so I'll skip this. We need to strengthen and launch our human milk bank with, the newborn care. And how can we do it? Path has explained that you can integrate this with your routine newborn care. And this was the model that was being used along with the UNICEF's support where mother-baby friendly hospital initiative is being used. Common maternal indications for use of pasteurized donor milk, I think everybody knows, and I can easily skip on to this slide also for want of time. But definitely when mother has infections either with HTLV or with Ebola or with brucellosis or double mastectomy done, definitely we will need the support of the human milk bank. These are the recipients, and this is also a simple slide of which all of you all know about. Who are the stakeholders, including the donor mothers, including the health professionals, the governments, the NGOs, the recipients, and the private sector partnership is very essential. What are the types of human milk banks and current providers for the human milk bank? We have the non-profit banks, like we have those at the large teaching hospitals, government hospitals, municipal hospitals. We have the commercial or for-profit banks, again an inverted comma for the Bangalore company. We have the centralized operated and the decentralized operated human milk banks. We are going to have, thanks to Mr. Ashok Gupta ji, we would be having a community-based human milk bank. We already have the facility-based. So these are various ways of just telling you all what are the different types of human milk banks and who are the current providers, where we've already had a lot of discussion on peer-to-peer markets, and we have the non-profit banks and the for-profit banks who are the main suppliers of human milk. I just put one slide for our global practices and studies from other countries, and that's the country that we look forward to, and that is Brazil. Brazil has the world's largest and most complex networks of comprehensive human milk banks. They're the world's #1 country with maximum banks, and I think in 2022, there were some 276, I think in the next slide, 228 out of 750. And India is it's not far away. We are already 124. If one man who changed Brazil, his name was JG, in short I'm using Almeida. And the irony of the situation is that we have Armida ma'am. The L got replaced with R, and we have Madam Armida Fernandez, who made a difference in our country. And it's not just one man who made that difference. In India, we have, of course, Madam Armida Fernandez, but we have another very great man, and that's none other than Dr. Damaria Yadia, who is doing excellent, or who has done excellent work for setting up exemplary human milk banks, the CLMCs, and how the milk will get transported. In Brazil, all the milk is collected from home collections, and it is transported to the main centers by using the services of fire brigade people as well as of the postmans. They all come on bikes and they collect it and do it free. So this successful model is being tried here by Dr. Damaria, who has ensured that we follow the spoke and hub pattern. And in the hub pattern, that's where his center was. And he ensured that from 6 sub-districts or 6 places, the milk from home is carried by the bus drivers, whom he has trained and given them enough advocacy. So we are looking forward, and the milk comes in within 2 to 3 hours from these centers, and he's doing an extensive work. Thank you very much for giving all this back to the society. And we are no less than Brazil now. So these are our triumphs. We have this overview of Indian scenario. Our first bank was started way back in 1989 by Madam Armida Fernandez. And approximately to date, we are 124, with the last bank being opened at Mohali 5 days ago. The leading states being Maharashtra, Rajasthan, Tamil Nadu, and almost all are in government sectors. Private human milk banks supply to their own hospitals. Our triumphs have continued with India's initiative of CLMC, and the human milk banks are saving, and they are a key part already into the integrated newborn care and nutrition program. National Health Mission has made it and is giving money to set up the CLMCs. In addition, the program of MA, which is the Mother's Absolute Affection program, has complemented the breastfeeding program's activities, both at community and the facility level. And this has improved access to life-saving human milk. And these are our organizations of our, we have the LSUs, which are at the delivery points, the LMUs, which are at the district level, and then we have the CLMCs, and I won't go further with it. We also have, as per NHM, 4 zonal comprehensive lactation management centers. In the West, which was started first not only as a human milk bank, but it is the state-of-art zonal center at Sion Hospital, LTMG, being run by Dr. Jayashree Monkar and Dr. Swati Manerkar. In the north, we have at Jaipur, the J.K. Leon Hospital. In the east, we have the IPGMER at Kolkata. And in the south, we have the ICH at Chennai. So human milk ensures that breastfeeding promotion, the banking ensures that breastfeeding promotion, support, and protection is occurring. What are the challenges that we are facing? We have no regulatory, legal, laws or a framework written for it. We are facing a lot of ethical issues, and it's the need of the hour to have clear policies and regulations. We have challenges of infrastructure as well as operational challenges. Quality control, how are we ensuring that we are giving just the right appropriate human milk bank? What about the safety standards? The donor recruitments, how are we getting retention of these donors? How do we encourage them? Addressing donor concerns, financial sustainability, cultural and social issues, especially amongst those who are following the Quran, and we have difficulties because of their taboos and myths and misconceptions. And what are the recommendations and the way forward? Recommendations are to have regulatory issues, quality and safety of the donor human milk, to have good quality management systems, collect the data, have outcome registers. Let us deal with the ethical issues, analyze the commercial human banks, and integrate the human milk banks with the breastfeeding promotion, with promotion of skill lactation care as a core component, which already our government is doing, and the need for formalized global coordinated body that can monitor even us. What is the future of human milk banking in India? We really need to scale up the number of milk banks across India. We need to address the rural areas and the underdeveloped regions. What is the vision, our vision for expansion and integration into the healthcare system? And we should ensure that there is a long-term sustainability and impact. So the conclusions are that institute skilled lactation care to all mothers, integrate human milk banking into a part of the newborn care, spread awareness and advocacy, establish more human milk banks, follow the hub and spoke methodology. Let's use equipment which is more cost effective and efficient. Thank you to Mr. Ashok Gupta ji, who said that he can make a lot more of the instruments which will be locally made and will be cheaper, ensuring that we have standardized equipment, stricter regulations and laws, and standardize the operating procedures. Last but not the least, stop commercialization of human milk banking. Thank you very much for a patient hearing. So let us ensure that we give these tiny treasures the best start in life, and let us support more NICUs with human milk banks. Thank you.
Thank you, madam, for this excellent, comprehensive talk on this subject, which is really very challenging to cover everything in such a short period of time, which is allotted to you. You told us about the general issues related with the milk banking. You also told us about the challenges, and I'm glad that you also gave some recommendations and then carry home messages, and ended your talk with the statement that stop commercialization of human milk banking. So thank you very much for this important message. So we close the session here. Thank you very much. Thank you very much, madam. Thank you.